Vaginal diseases encompass a range of infectious and non-infectious conditions affecting the vagina and vulva region. Among women of reproductive age, infectious vaginitis, an inflammation or infection of the vagina, is a significant global health concern due to its high prevalence and potential reproductive health consequences, including preterm birth, infertility, and increased susceptibility to sexually transmitted infections such as HIV. Under healthy conditions, the vagina is predominantly colonized by lactobacillus species, which produce lactic acid and maintain a low pH of approximately 3.8 to 4.5. This acidic environment inhibits pathogenic organisms. Disruption of this microbiome balance can lead to vaginal dysbiosis, resulting in overgrowth of harmful microbes and inflammation. Altered vaginal flora is implicated in bacterial vaginosis, vulvovaginal candidiasis, and other infections. BV results when good lactobacilli are depleted and replaced by anaerobic bacteria such as Gardnerella vaginalis, Prevotella spp, and others. This imbalance raises vaginal pH and produces symptoms like malodorous discharge and irritation. Global BV prevalence among women of reproductive age is estimated at 23 to 29%, making it one of the most common vaginal conditions worldwide. Studies in Tanzania found BV among vaginal infections in up to about 33% of symptomatic women presenting for care. While not traditionally classified as an STI, evidence indicates sexual activity influences BV risk, and treating male partners may reduce recurrence, suggesting sexual transmission may contribute to spread. VVC is caused by overgrowth of Candida yeasts, especially Candida albicans, arising when protective bacteria decline or vaginal pH changes. Antibiotic use, hormonal shifts, and immune suppression are common triggers. VVC affects millions of women globally, with lifetime incidence estimates indicating that up to 75% of adult women will experience at least one episode. Regional prevalence varies. In Ghana, VVC was found in about 36.5% of pregnant women, and in Kampala clinics, about 33% of women with infectious vaginitis had yeast infection. Trichomoniasis is caused by the protozoan Trichomonas vaginalis. It is a sexually transmitted infection characterized by frothy discharge, itching, and discomfort. In many cases, infections may be asymptomatic but persistent. Globally, T. vaginalis affects approximately 57 to 180 million people annually, predominantly in developing regions. Prevalence among symptomatic women varies by region and demographic group. The likelihood of contracting vaginal infections depends on multiple factors: sexual behaviors, antibiotic use, hormonal and physiological changes, and immune status. Effective prevention requires multifaceted approaches spanning personal hygiene, sexual health practices, and healthcare engagement. Use condoms consistently to reduce transmission of STIs, including trichomoniasis and HPV, which indirectly impacts vaginal microbiota. Limit number of sexual partners and engage in mutually monogamous relationships when possible. Consider screening and treating sexual partners when appropriate. Regular gynecological exams help detect asymptomatic infections early. Screen for STIs in sexually active women, especially those with symptoms or high-risk exposure. Pregnant women should receive routine screening to prevent complications. Manage chronic conditions to reduce susceptibility. Maintain a balanced diet and consider probiotics under clinical guidance to support microbiome balance. Based on global literature and population studies, the most common vaginal conditions among women of reproductive age are bacterial vaginosis, a condition of microbial imbalance affecting up to about 30% of women, linked to reproductive sequelae and STIs. Vulvovaginal candidiasis, with high lifetime incidence and frequent episodic occurrences worldwide. Trichomoniasis, a sexually transmitted protozoal infection with substantial global prevalence. Together, BV, VVC, and trichomoniasis account for the majority of infectious vaginitis cases globally, with high prevalence in both low and middle-income regions and considerable impacts on women's reproductive health and quality of life.